This video is an introduction to injection calculations. We will cover some basic calculations usually associated with subcutaneous injections, IM injections, or even some IV medications, basically anything that's you're drawing up in a syringe. Now, there are a lot of different variations on these types of injection medications, and we won't be covering all of them today, but I would like to introduce some basic principles. So when you're giving an injection, you're typically using a syringe. As you can see down here, a syringe, this is a 3 ml syringe. It holds a maximum of 3 milliliters. Now, there's lots of different types of syringes, and in this video, we are not going over those, but I just wanted you to understand that when you are solving these calculations for injections, you're going to try to find the volume, and typically that is in milliliters because you're filling up the syringe with liquid, and we measure liquid in milliliters. Now, some syringes, the exception to this is typically insulin. Insulin is measured in units, so insulin units would be in a different type of syringe. Those syringes are specific for insulin. They have an orange tip on them. They have a smaller needle typically than what this looks like. There's a lot of variations. Make sure that if you are giving insulin to a patient, you are only using an insulin syringe. In this video, we are primarily focusing on finding the milliliters, so we are not covering insulin. Some of these medications are ordered first in milligrams, sometimes they're ordered in micrograms, sometimes they're ordered even in units. Something like heparin can be ordered in units. There's other medications that can be ordered in units too. And we'll do a few variations on these. These aren't the only measures of weight or measuring doses that you'll see, but you're basically trying to go from these various measurements in the orders to your milliliters so you can fill up the syringe with the proper amount. The other thing to understand is that when you are giving these injections, again, some of them are sub-Q or IM, so they're going into subcutaneous tissue, IM tissue. There's obviously other types of injections too, but those are the majority of them. If you're giving something IV, you are not going to be using this needle. Typically, you're connecting a Lurlock portion on the syringe to another connection on the IV tubing or the hep lock, saline lock that is connected to that patient. So that process is not something I'm going over in this video. I'm just going to focus in on the calculations. These calculations are very similar to the calculations that we went over for liquid medications. So if you haven't done those calculations already, I recommend you start with liquid medications and then move on to injections. The key pieces of information are the same. We're going to look for the order, then we're going to look for what's available to us in the form of usually a bottle of medication or a vial that we can actually stick the needle into and obtain the liquid that's inside. This available medication should not just have the dose, but it also should have the dose per how many milliliters that it's in. So a dose and a volume so that you can understand the ratio of medication to liquid in that available packaging. So 3 pieces of information, the order, and then from your available, you need the dose and the milliliters, and then that's going to give you the opportunity to calculate how many milliliters to give your patient. All right, let's move on to some example calculations. And starting with our first example is a heparin question. This is a more common order that you might see in the hospital for a patient that's not mobile and the providers want to prevent deep vein thrombosis. So when we go through this question, let's remember to find our key pieces of information. We first want to make sure that we find the order, and then we want to find what's available. So let's read it. A patient requires heparin 5,000 units subcutaneously every 8 hours. The available medication is in vials with a concentration of 5,000 units per milliliter. How many milliliters should the nurse administer for each dose? So first things first, circle your order. We see here we have heparin 5,000 units. And then when we go to look at what's available, what do we see here? We see a concentration vial. So we're finding 5,000 units per milliliter. That's what's available for this patient. So those are our key pieces of information that we need to know before we start our calculations. We always start our calculations first things first with our order. And then we're going to multiply it by our available. And it's first the available milliliters per the available dose. So if you want to think of this almost as a little available medication that is dispensed from the pharmacy in a little vial, it's a little rather wide vial, but that's kind of the idea, and that can help you remember that you start with your order and then you move on to the available medication. You should also remember that you need to have the milliliters on top always and the dose on the bottom when you're starting with an order that is a specific dose. So be sure that works out. When we do these calculations, you'll understand that the units of measure can cancel, and that's another check you can do. All right, let's start with our actual numbers now that we've reviewed the way that these calculations should be written out. We have 5,000 units as our order. We're going to multiply that by our available medication, and we know that the 5,000 units that's available in that vial goes on the bottom here, and that's equal to 1 milliliter. So I know that there's 5,000 units twice in this question, but that's because 5,000 units was ordered and 5,000 units is available per milliliter. All right, you can see here that these units of measure cancel. Units cancels units, and we're left with milliliters, which is what we want. So let's do the math here. We have 5,000 units times 1, that's 5,000, divided by 5,000, and we are left with 1 milliliter. So the math on that is fairly simple. But you need to understand how to set up those questions so that if the math doesn't align like that and you're not giving an even 1 milliliter, you can still do the calculations on your calculator. Let's move on to another example. Here, a healthcare provider orders morphine sulfate 5 milligrams intramuscularly, so this is an IM injection. It's every 4 hours as needed for pain. The available medication is in ampules with a concentration of 10 milligrams per milliliter. How many milliliters should the nurse administer for each dose? First things first, what's our order? Morphine sulfate, 5 milligrams. All right, then what is our available medication? Our available medication is 10 milligrams per milliliter. That's in an ampule. Now, there's lots of other information in these questions, and this isn't even that wordy of a word problem. Sometimes students want to use this information over here, this 4 hours, or other numbers that are available. Just because there's a number doesn't necessarily mean you need to use it in this question. This question is asking how many milliliters for each dose. So we're not trying to figure out the whole day, we're just trying to figure out this dose. So be mindful, part of being good at calculating and completing these word problem calculations or even real life calculations is being able to distinguish which information you need at that time. All the information usually in the order and written in the computer is important, but it's not all relevant to your calculations. So make sure you pick out those 3 key pieces of information. Starting with your order, you're supposed to give the patient 5 milligrams for every dose. So that's our order. Then we're going to multiply it by what's available. And we know that we have 10 milligrams per milliliter available to us. We can put the 10 milligrams on the bottom since the order is on the top with milligrams there. And then we have 1 milliliter on the top. So cancel those units of measure, right? 5 times 1 is 5. And then the bottom is just 10. 10 times, well, you could say 10 times 1, but 10 times, it's just 10 at the bottom. So 5 divided by 10, we are left with 0.5 milliliters of the medication. Now, some of you might have to take this further in a lab setting, in the clinical setting, or even on your paper and fill in a syringe. Make sure you look at that syringe very carefully in the lines on it and you pull it up to the correct amount. Getting used to syringes is a whole nother skill beyond just calculating. So be mindful of that as you do these calculations. That's just the first part in getting your patient the safe dose. Now let's move on to some more examples. Here we have a patient requiring vitamin B12, 750 micrograms intramuscularly weekly. The available medication is in ampules with a concentration of 1 milligram per milliliter. How many milliliters should the nurse administer for each dose? All right, key pieces of information. Hopefully you can say them to yourself now. You first need the order. All right, that's vitamin B12, 750 micrograms. Then you need your available. We have an ampule, its concentration is 1 milligram per milliliter. Now, we see here milligrams is listed, but in our available, we have micrograms. So we're going to kind of have to work with that and do a unit conversion. Again, in the liquid video, I explained how liquid medications, we can do these types of conversions right within our dimensional analysis. And hopefully you can figure it out here again. Let's start with our order. We know we need to give the patient 750 micrograms of B12. Now, we would like to just go right to our available medication, but that's listed in milligrams, so we know we can't do that right now. We first need to go from micrograms to milligrams. Now, I put micrograms on the bottom here because, as you can see, it's on the top here, so this is going to cancel this unit of measure, and we'll be left with the milligrams here, which is great because then we can use our available medication. Let's not forget to fill in our conversion factor here. We know 1,000 micrograms is equal to 1 milligram. Again, the conversion factors, that's this fraction ratio that I'm talking about here, they're always equal from the top to the bottom. So you will never have to make up a conversion factor. It should be given to you, or you should memorize the ratios like 1,000 micrograms equals 1 milligram. So here we go. We have our order first. That's up here. Then we have our unit conversion. All right. And now we're moving on to our available medication, or you could say the dispensed medication or what's given to you. There's a few different ways of describing that. All right, let's move and put our available in here. Now, just like before, we know the milligrams goes on the bottom because it's up here. We're going to cancel milligrams and milligrams. 1 milligram is equal to 1 milliliter for this patient. That's what it says up here in the question. All right, now we have it listed out. We're going to end up with the milliliters for this patient after we do this math. So 750 times 1 is 750. Then we know the bottom is 1,000 times 1, which is 1,000, which gives us a final answer of 0.75, and make sure you label it with milliliters. That's that volume you're going to drop in the syringe for this patient. And it's an IM injection. I think it's really important for some learners especially to make sure that they visualize the concepts related to these sort of questions. So that might mean for you that you imagine the little ampule where this medication is when it says ampule, and you think, oh, yep, that's what I'm going to be drawing up this medication from. When you see IM, you understand that you need to give an IM injection. So you're going to be using a syringe, there's going to be a needle, you're going to be filling it with milliliters of liquid. And then imagine your order being written in a chart. If those visuals help you, you could draw pictures when you're first practicing. For some students, visualizing these aspects of the written question are so helpful in them understanding what's really going on and really remembering the overall concept of the calculation. All right, let's move on to the next question. And I hope you're remembering to find your key pieces of information as we go. A patient's prescribed enoxaparin 60 milligrams subcutaneously twice daily for deep vein thrombosis prophylaxis. This is very similar purpose than that heparin question we did, but it's a different medication here. It's enoxaparin. The available medication is in prefilled syringes with a concentration of 40 milligrams per 0.4 milliliters. How many milliliters should the nurse administer for each dose? So we have here, where's our order? They're prescribed enoxaparin 60 milligrams. And what's our available medication? Its concentration is 40 milligrams in 0.4 milliliters. Now let's write out our calculations. We have our order, 60 milligrams, times our available medication. This available medication comes in 40 milligrams, and it is in 0.4 milliliters. All right. We then can move on to making sure our units cancel, just to do that double check. We see here milligrams cancels milligrams, and we're left with milliliters. Great. All right, and now let's do our actual math. We got 60 times 0.4, which comes out to 24, and then we have the 40 on the bottom. So when we do 24 divided by 40, we are left with 0.6 milliliters. So that's how much we're going to give our patient, that subcutaneous injection. All right, let's do one more example. We have a healthcare provider that prescribes epinephrine, 0.5 milligrams intramuscularly stat right away. The available medication is in ampules with a concentration of 1 milligram per milliliter. How many milliliters should the nurse administer for each dose? All right, let's look at our key pieces of information. Hopefully you found the order, epinephrine 0.5 milligrams, and hopefully you also found the available concentration there. Now let's move on to writing the calculations. Our order is to give the patient 0.5 milligrams, and our available concentration comes with 1 milligram per 1 milliliter. Again, if it says just per, you can assume there's a 1 there. So every milligram has 1 milliliter, is in 1 milliliter. All right, doing the math here, we have 0.5 times 1, and then divide it by 1, so 0.5 divided by 1, which gives you 0.5 milliliters. So this patient will get 0.5 milliliters of an injection. As you continue to practice these types of questions, don't forget to be labeling your answers at least, but it's really helpful when you start with labeling your order and all that's available, especially if you do unit conversions. That's also a helpful step so that you do not make what seems like a silly mistake that becomes a big safety issue for your patient. If you're interested in learning more about IV injections, you will want to check out the IV push video, because unlike subcutaneous and IM or other routes that aren't in an IV, you will need to be careful when pushing IV medication right into someone's veins through that hep lock, that saline lock, because it needs to often be done at a particular speed. And the IV push video will help you determine not just how much medication to drop in your syringe, but also how to give it over a specific amount of time. So be mindful of that as you move forward. This is just one step in your calculations, and there's a lot more to the process of giving those medications safely.